Are you taking melatonin every night? You might want to hear this. The FDA just sent out a serious warning after a recent study found something pretty shocking. People who used melatonin long term had a much higher risk of heart failure. We're talking about a study that followed more than 130,000 adults for 5 years. The results weren't small either. Melatonin users were hospitalized for heart failure more than 3 times as often, and their chance of dying was almost double compared to people who didn't take it. Dr. Marie-Pierre Saint-Onge from the American Heart Association put it plainly: melatonin is not something you should take every day unless a doctor has a real medical reason for it. So what does this mean for you? A lot of heart doctors are rethinking sleep supplements right now, and honestly, this brings up a bigger question: which supplements actually help your heart, and which ones could be doing more harm than good? In this video, we'll break down what really works, what to be careful with, and what new research says about dosage, timing, and mixing different supplements. Let's get into it. If you take melatonin to help you sleep, this might surprise you. A large new study found that people who used melatonin for more than a year had a much higher risk of heart failure. In over 130,000 adults, long-term users were hospitalized for heart failure more than 3 times as often, and their overall risk of death was nearly double. The study was solid too, with over 40 factors accounted for. Researchers aren't saying melatonin definitely causes these issues, but high doses may stress heart cells, disrupt the heart's natural rhythm, or affect how the body handles sugar. If you use melatonin, don't panic. Just consider talking with your doctor, especially if you take it nightly. And remember, lower doses often work just as well. Many people get good results with 1 to 3 milligrams about 30 to 60 minutes before bed. Have you noticed any changes when taking melatonin regularly? The next supplement on the list actually has some encouraging news for people on heart medications. If you take statins, here's something many people never hear. Statins lower cholesterol, but they also lower CoQ10, a nutrient your cells need for energy. Levels can drop by up to 54%, which hits your heart and muscles the most. A large review of 12 clinical trials showed that CoQ10 clearly reduced statin side effects like muscle pain, weakness, cramps, and fatigue. The dose didn't matter much. People improved whether they took 100 or 600 milligrams, and whether they used it for a month or 3. For anyone getting muscle symptoms, many doctors suggest 2 to 300 milligrams a day, split into 2 doses with meals. It usually takes 6 to 12 weeks to notice real changes. CoQ10 seems to help your cells produce energy more efficiently, which is why starting it early can be helpful. It's also considered very safe, making it a reasonable option for most people on statins, especially older adults or those on higher doses. How about you? Have you had muscle issues with statins, and have you ever tried CoQ10 to help? Our next supplement might be the most underrated mineral for heart health. Magnesium is one of the most overlooked minerals, yet your heart relies on it for proper rhythm and healthy blood pressure. Most people never realize they're low because standard blood tests only show a tiny fraction of your magnesium levels. A 2025 review of 38 trials found that magnesium lowered blood pressure by about 2 to 3 points, and by almost 8 points in people with hypertension who were already on medication. The dose didn't matter much. Whether someone took 80 milligrams or 600, the benefits were similar. This suggests the key is correcting a deficiency, not taking large amounts. Even small drops in blood pressure can reduce the risk of heart attack and stroke, which makes magnesium especially helpful for people with high blood pressure or known low levels. The best absorbed forms are magnesium citrate, glycinate, and malate. Magnesium oxide is cheaper, but not absorbed as well. Do you know if you're getting enough magnesium in your diet? The next supplement comes from an ancient food with remarkable blood pressure benefits. If there's one supplement almost everyone asks about for heart health, it's omega-3s, or fish oil. And honestly, the science behind it is strong, but with an important twist most people don't hear about. For starters, omega-3s are well known for lowering triglycerides. In fact, they're one of the most effective natural ways to bring those numbers down. Studies also show that moderate fish oil intake can lower the risk of heart attacks, especially in people who already have heart disease. But here's the part. You need to know newer research is uncovering a problem with high doses. When people take large amounts of fish oil, especially prescription strength or megadose supplements, the risk of atrial fibrillation goes up. That's an irregular heart rhythm that can raise the chance of stroke. And in a few trials, extremely high doses were linked to a slightly higher stroke risk in certain groups. So what does this mean for you? It's not that fish oil is bad. It's that more isn't always better. Most of the benefits come from moderate doses, not huge ones. And if you already have heart issues or take blood thinners, it's definitely worth talking with your doctor before adding fish oil. Used wisely, omega-3s are still one of the most reliable supplements for heart health. The key is hitting the right dose, not maxing out the bottle. Up next is a powerhouse plant compound that works on cholesterol, blood sugar, and even inflammation. Berberine has become popular for a reason. It doesn't just act like a natural statin, it also helps the body manage fats and sugar more effectively than most supplements. A major analysis identified a berberine signature, a pattern in proteins and hormones linked to lower cholesterol, better glucose control, and reduced risk of heart disease and diabetes. A 2025 review of many studies found that berberine lowers triglycerides, fasting glucose, waist size, LDL, total cholesterol, and even improves BMI shorter use, around 90 days or less, often showed the biggest changes in HDL and LDL. Safety looks solid. In clinical trials, berberine performed about the same as placebo, with only mild digestive issues reported by some users. Berberine is now one of the most researched natural options for metabolic health, covering several major heart risk factors. Have you heard of berberine before? The next supplement has even more to offer for people with heart failure. Taurine is a supplement many people overlook, but the research behind it is impressive. It's a natural amino acid your body makes, and multiple studies show it can strongly support heart health. A 2024 review of 20 clinical trials found that taurine lowered heart rate by almost 4 beats per minute, reduced systolic blood pressure by about 4 points, and improved heart pumping power by nearly 5 percentage points. That increase is especially meaningful for people with heart failure. The benefits showed up in healthy adults, people with high blood pressure, and those with heart failure. Blood pressure improvements were strongest in those with hypertension, while heart pumping strength improved most in heart failure patients. Taurine works by boosting levels inside heart cells, reducing oxidative stress, lowering cell damage, and limiting scarring. One study showed a major drop in a marker of oxidative damage from 329 to 83. With no serious side effects reported, most people respond well to 1 to 3 grams a day, having results appearing in a few weeks. Did you know taurine could do all this? The next supplements may be the most powerful natural cholesterol-lowering combination we have. If there's one duo that keeps showing up in heart health research, it's vitamin K2 and vitamin D. Most people think of them for bones, but together they may actually help protect your arteries too. Here's why. Vitamin D helps your body absorb calcium, but it doesn't control where that calcium goes. That's where vitamin K2 steps in. K2 activates special proteins that help move calcium into your bones and away from your arteries. And when those proteins are switched on, your blood vessels are less likely to stiffen or develop calcification. Some studies have shown that people who get enough K2 have slower arterial calcification over time. A few trials have had mixed results, but the overall trend is promising, especially when K2 is combined with vitamin D. Think of it like a traffic director for calcium. D brings it in, K2 tells it exactly where to go. What's interesting is that K2, especially the MK7 form, seems to work best at everyday doses, not mega doses. And the safety profile is excellent for most people, aside from those on blood thinners who should check with their doctor. So while vitamin K2 isn't a magic fix, it's definitely becoming one of the more talked about nutrients for long-term vascular health, especially for anyone already taking vitamin D. Alright, before we wrap up, here are a few quick action steps to keep you safe and informed. If you use melatonin, especially every night, it's worth talking with your doctor about how it might affect your heart and what other sleep options you have. And the same goes for any of the supplements we covered today. Before you start something new or mix different products together, get professional advice. This is especially important if you have heart disease, diabetes, high blood pressure, high cholesterol, or if you're taking medication for blood clotting. Now, we want to hear from you. Have you tried any of these supplements for your heart or your sleep? What was your experience? Drop your story in the comments, and if you found this helpful, make sure to subscribe and check out our video. The morning drink that melts artery plaque and boosts heart power, and learn how it keeps your arteries young, supports healthy blood pressure, and boosts circulation, so your heart thrives naturally. Don't forget to like, subscribe, and tap the notification bell for more Heart Smart Health videos.